Good morning, everybody. I want to welcome you and thank you for attending today. My name is Pamela Johnson, and I'm pleased to give an overview of opportunities in the Medicare insurance business. And I hope today to provide you with information on what's involved with becoming a healthcare Medicare insurance agent. Bear with me for a second. Oh, there we go. Okay. So the objectives of this workshop is to give you a background and talk a little bit about how I got into the Medicare business, provide a broad overview of Medicare and the opportunities for brokers. It's an exciting time as we have many people turning 65 every day. What you can expect in terms of how much you can make, how do you find clients, how will you be paid, and then I want to open it up for questions and answers. So this is me. My name is Pamela Johnson, and I specialize in solutions for the senior market. I do have both a life and a health insurance license. I've been licensed since 2009, and I am in New Jersey, so I have a resident license in New Jersey and a non-resident license in Delaware, Florida, Maryland, New York, and Pennsylvania. I've been doing Medicare since 2013 and sort of gradually got involved with the ins and outs of Medicare. I am contracted with the top providers in New Jersey. So I have contracts with United Healthcare, Aetna, Amerigroup, Clover, Horizon Blue Cross Blue Shield, Cigna. The list goes on, and as we go into it, you'll understand a little bit more about how this all works. I am a 1099 contractor, as would anybody who comes into it. So although I'm, recruiting agents, you will be independent and you will work for yourself. So I want to try to just give a broad view of, Medicare and what it is and why this is important. So if Medicare is free, why do people need Medicare brokers? And what exactly is Medicare? That's the question, that a lot of people, are curious about. So Medicare is not free. I'll just start by answering the question. When you work and you pay into your Social Security, a disability, and Medicare, it's a tax that you pay throughout your working years. And it is a deduction from most people's paycheck, and you pay into it over the course of your working years to be able to have Social Security benefits when you retire. Part of that benefit includes Medicare. So Medicare is a program that provides health insurance for people 65 and older, and individuals who are under 65 who qualify for disability. In 2020, there were about 62 million people enrolled in the Medicare program, and that is expected to grow to another 51%. This says the year 1930, 2030. Sorry about that. So it's also designed for people who have certain conditions. So end-stage renal disease, which is kidney failure, those individuals will also qualify for Medicare. This little red, white, and blue card is what you get when you turn 65, you've paid into Social Security, and you enroll in the Medicare health program. But in doing so, you are actually paying a premium back to the government for part of a portion of your Medicare. And we'll get into that a little bit later. So that premium that people pay to the government is $148.50 a month, which totals about $17.82 a year for most people. higher income people, people who earn more when they're 65 or the year they're 64, and if they're still working, over $80,000 a year, that monthly premium will be even more than that. And there's a graduated scale. So in addition to the fact that when you qualify for Medicare, you still have to pay for it, original Medicare only covers about 80% of medical costs. So it's not entirely, you still have a responsibility to pay out of pocket for the portion that Medicare does not cover. Original Medicare consists of three main parts. You have the hospitals, Part A, you have the doctors, Part B, and you have the prescription drugs, which are Part D. So there's a lot of letters when you hear about Medicare. A, B, and D are the main pieces that were addressed in the legislation concerning Medicare. So how do people learn about Medicare? People hear about it, they learn about it from their doctors, friends, senior centers, employers, financial advisors, churches, and the Medicare.gov website is a very good source of information for seniors and for people turning 65, but it is quite overwhelming to understand the circumstances. Each person has a different set of circumstances. Some people are still working, some people have not started receiving Social Security benefits, some people have. People have specific circumstances around their health needs, how they want to receive health coverage. And so with all of the confusion around Medicare, Medicare brokers provide a real and needed service to Medicare beneficiaries when they're first eligible for Medicare. There are a lot of consequences if people do not understand what they're supposed to do, when they're supposed to do it, and what their choices are. And as a Medicare advisor, that's part of the role. It's not really selling, because when you do turn 65 and become eligible, you have to make a choice. You can't do nothing. And so that role of the broker becomes an advisory role. I also want to encourage you to ask questions. If there are any questions that you have as I'm going through this, please feel free to just jump in and ask me a question if anything's not clear. I'd be happy to answer anything. Medicare and You is also a booklet that people get when they turn, you get every year once you become eligible for Medicare, and every single year you get an updated Medicare and You book. It's kind of the full Bible and with a lot of information. Again, it's some people feel overwhelmed with it. Some people read it cover to cover and still aren't sure what choices they're supposed to make or what they're supposed to do. I just also want to take a minute to talk about the cost of healthcare. So another reason this is so important is because with or without Medicare insurance, healthcare is a very large expense for retirees. And so managing this cost, making the important decision as to what healthcare plan is selected, it could really impact a person's retirement funds or what they've saved for retirement. This is a little bit, some older data from the Kaiser Family Foundation, which says that a couple retiring would spend an average of $285,000 of medical costs in retirement. Generally, women are spending more than men, and that might be because men don't live as long. So it's just statistically speaking, there's not the longevity. But that being said, either way, it could be a big chunk of a budget when people are on a fixed income. So back to my point, there's a tremendous need for advice. Um, Medicare beneficiaries must choose the health plan. There is a financial risk for not having a plan. As I mentioned, original Medicare only covers 80% of um, medical costs. And so you can easily imagine a hospitalization of 4 or 5 days running, upwards of $100,000 in medical bills. The beneficiary would be responsible for, without a healthcare plan, would be responsible for paying $20,000 easily on a $100,000 bill. That would be the Medicare beneficiary's responsibility, without a supplemental health plan. So it's important that this role explains how Medicare works, explains the need to make a decision. There is a window for signing up for Medicare when you first become eligible. Generally, that's a 7-month window, 3 months before your birthday month, and 3 months after the birthday. Healthcare and prescription drug costs for seniors can also be astronomical, and that guidance is important because not all plans don't cover the same drugs. So part of this is also understanding what medications, what health conditions someone has. There are also factors that would contribute, such as whether a person travels, whether they have doctors out of state, whether they're used to sticking to a network of doctors, such as a preferred provider organization, PPO, or an HMO. Many people who are retiring from companies that provide healthcare insurance are accustomed to having to work within a network of doctors, and so they're perfectly fine making that kind of a choice once they're on Medicare. Others want flexibility to see any doctor, and they have no interest in having to worry about whether a doctor is in or out of network. People's preferences really, really vary, and sometimes you imagine that someone would, pick a certain road, and it's not really the case. So there's an interview process. There's a dialogue that we have with, our clients and prospects to understand what their individual needs are, what their preferences are, what they're comfortable with. And that informs the recommendation that we make as Medicare brokers. There are 2 different pathways that someone may take once they're on Medicare. I skipped over a letter. So we talked about A, B, and D being part of the original Medicare plan. That means that you have the red, white, and blue card. You need a prescription drug card, and then there's something that they call Medicare supplement plans, or Medigap. Those plans cover the 20% that Medicare doesn't pay, and there are no networks. Any doctor that accepts Medicare would accept the supplement plan, and people that choose that route often have higher incomes because they can afford it. The Medicare supplement plan premiums are higher, but once someone has a plan, if they were to have a medical event, they don't have to worry about coinsurance or copays or networks. That's option 1. Option 2 are the Medicare Advantage plans, or what they call Part C. Part C completely replaces original Medicare, and it becomes a managed care plan. You no longer have to present the red, white, and blue card. You have one plan, which is called a Part C, that wraps the doctors, hospital, and prescription drugs all in one plan, one card that covers everything. That route has very low premiums, or even many of them are 0 premiums. In New Jersey, for example, there are a lot of 0 premium options, but these plans do vary by county. So as a representative of any of the companies, it's provided by private insurance companies. Um, you need to understand what's offered in your county. Um, you know, a lot of the platforms make it easy. You just put in the zip code and you get the menu essentially. The Medicare Advantage plans are the ones that you see on TV during certain time of year, which is considered annual enrollment, when there are endless commercials. Are you getting everything that you're entitled to with Medicare? And you see Joe Namath and Danny Glover and all kinds of stars promoting Medicare Advantage plans. And they are very popular because they include things that original Medicare plus the supplement plan do not include. And those would include dental, vision, hearing aids, fitness club memberships, over-the-counter benefits, and a lot of things. And the idea is to keep people healthy, to keep people out of the hospital. So I don't want to get too into the weeds of Medicare, but it's important to understand that there are two roads that people can take, and what the job is to help people understand what their options are and understand the timing and the importance of making a selection when they're first eligible. So why do I think it's a great idea to become a Medicare broker? Um, there are a number of reasons, and for me personally, I got into this because I needed flexibility in my schedule. I had my kids were younger, I needed to be able to go to teacher parent conferences. I needed to take kids to the doctor. I needed to be available to take kids to after school programs, and I needed that flexibility. And I've enjoyed that flexibility. Uh, Number two, rewarding. I should have make that number one. Um, Seniors are very, very grateful for the service that we provide. Um, making it simple and sort of walking them through the process. And the way we do that is through very simple presentations, very simple explanations, and providing people, narrowing down the choice of options so that they understand how you've come to a recommendation, but also they feel like they're part of that decision process. And then finally, there are income possibilities that with this, whether you're doing it part-time or on a full-time basis, you can set your goals, determine how much you want to work, and really begin making money as soon as you're licensed and certified in Medicare and contracted. It is not a very complicated process. Yes, you have to study for some exams, but once you become a licensed agent, there's not a high hurdle to get involved and to start to help people. And then what makes a good broker? I put patience as number one. In working with people who are anxious about having to face that they're getting older and having to face that they have to understand Medicare and that they must make a choice. There's a lot of anxiety. There's a lot of worry about the future. So it requires people who are patient. And as you deal with people once they're already on Medicare, there's ongoing service, there's ongoing communication with your clients. It's very important to maintain the relationships with your clients, to be organized and to have good communication skills. So before I go on, are there any questions before I get into what it takes to be a Medicare representative? Any questions? Okay, I'm going to share the screen again and go back into how how you become how do you become a broker? So to sell Medicare plans, you need a health insurance license, and that generally renews every 2 years, I think, in most states. In order to expand the number of states, you need a non-resident license in other states, and that's a simple. Once you have a resident license, it's a very simple online application process to expand your states. But for right now, I would encourage people to get licensed in their resident state, and to do that, you have to go through background check and fingerprinting. You'll need errors and omissions, or what they call E&O insurance, which is a type of business insurance to protect you from, anybody claiming that you forgot to tell them something, or that if you tried to cheat them. Medicare is very regulated, so the sales process, it's pretty much foolproof, because there are certain things that you will say, there's certain things that are in the script, and there isn't a lot of liability, but just in case, the companies require that you have that business insurance. There's the America's Health Insurance Plan annual Medicare certification. It's an online platform. You go through the modules and you do testing. It's all online. It probably takes a couple of days to go through the modules. Once you're licensed, and have your insurance, you contract with the different companies, then you get a link. So this is sort of flipped. First you contract, then you get a link to take this Medicare certification, and then you'll go through product training and sales training. I also want to say that any agent that I'm working with will have training from me, from some of the companies that I work with. I have a relationship with Aetna, for example, and my broker manager has agreed to help with the training and the sales training. In terms of doing the business, we are still in a COVID world, and I do not meet with people one-on-one. So it's either video conferencing, such as Zoom, or over the phone. If someone does not have access to a computer, then it's a multiple step process if it's a phone sale. So it would involve mailing out a kit, setting an appointment. Once they get all the information, scheduling a phone call so that the beneficiary has something concrete in front of them, as I'm explaining their options. So we've found a way to shift to do this work and work with people in a timely way, whether or not they have internet access. Most people, I would say 80% of people who are turning 65, who are new to Medicare, the younger ones who are in their 60s, pre-70, they're pretty tech savvy. Everybody knows how to use Zoom now. So that is helpful, because I like to be able to share a screen, and in the way that I showed the different parts of Medicare, that was an abbreviated presentation that you saw today. There's a sort of a more guided approach. There's also pre-recorded videos that you can share with people if you don't feel comfortable that you're quite understand all these different parts. There are pre-recorded, and you can just share your sound and the video that completely explain all the parts that they need to understand, and then you can answer the questions afterwards. So I guess the silver lining of this year in quarantine, or working remotely, it's given this business, it's given people new opportunities to expand. I literally expanded my business in 2020, and that was because there were limitations to how many people I could see driving and meeting people. Pre-COVID, I would meet people in libraries or Paneras or coffee shops to have initial meetings. I would sometimes go into a home if it was a referral from somebody I knew, or that was a model that sometimes I would meet people at home, but generally I would meet people in the library or a coffee shop. During COVID, I was able to cover a broader geography. I was able to help people. I'm licensed. I mentioned that I have life insurance license as well. And so I'm licensed in multiple states. So I was able to do that with Medicare. I was able to help a couple in Maryland. I've been able to help a snowbird. So I had a client that started in New Jersey, moved to Florida, and I was able to help her with her Florida Medicare needs. Again, but I've been doing this for 7 years now. So initially, there's enough business, especially in New Jersey, to get started and to, market in New Jersey. New Jersey is big. It's got a big population. I've had Atlantic County clients. I've had Bergen County clients, Sussex County clients, and that I had in 2020, where previously I was more restricted to my about three or four counties that I marketed in. So that is, so where do I find clients? That's the next, I guess, question of the hour, right? So how are you going to find these people turning 65? There are a number of different ways. First, who's eligible? And I mentioned you have people turning 65. You have people who are under 65 but receiving disability. Then you have the annual enrollment period, where everybody who's on Medicare has an opportunity to change during annual enrollment period, which is October 15th through December 7th every year. You have people who have recently moved to the state or who have moved to a new county. And then finally, you have eligible people who may be newly qualifying for state or government assistance, either a low income subsidy, Medicaid, the pharmaceutical assistance plan. And part of this role is also helping people in need. So if I come across a prospect and I see that they are someone who's really struggling, I'll tell them about some of these programs that they might qualify for. I might encourage them to get their children or anybody that helps them to fill out these applications to qualify. Once they qualify, they're eligible to change plans or get into a new plan. That's a year-round opportunity for prospecting. So how do I find people? So pre-COVID, I pretty much pursued any opportunity that I could to find clients. I would staff a table at CVS or a kiosk at a Walgreens. CVS, Aetna had CVS stores as part of their retail program. AARP or United Healthcare had Walgreens. In 2019, I was at both. One day I was at CVS, and 2 days I was at Walgreens. And you have walk by traffic. That was during annual enrollment, so there were lots of commercials on TV, and you would get people who would stop by, fill out a card, and then I would follow up with them. That was pretty successful. You have churches, religious organizations, senior centers that you can contact and offer to do a presentation. Why this works is because as an independent agent, you're representing multiple plans. So you have a better chance of getting into those places than if it's a, Aetna company representative or just one company. You are there to advocate for seniors and help. So you have to kind of also use your own personal networks to just approach these different places. It could be a senior building. It could be a senior active adult community. Again, religious organizations, community centers. There are a lot of different ways to reach people. There's social media, if you're a social media expert. And even if you're not, a lot of these companies provide all the social media tools that you need to do that and to start doing it that way. The number one, the third one here, that should be number one. Tell people what you do. You need to have a 30-second or less description. I am a Medicare representative and I help seniors make very important decisions around Medicare. If you're just doing Medicare, then you make that part of your 30-second or less pitch. You tell people do not make it a secret. One of some of my best clients came from my church, and I helped one person, and she was in a book club, she was in a walking club, and she told her friends when they were younger than her. So when she turned 65, the next year, she referred me to a friend who referred me to two more friends who referred me to another one. And so you're building relationships, but you can't do that unless you tell people what you do. You can also try reaching out to companies who hire seniors. A lot of times you see in local stores, grocery stores, a local mom and pops hire seniors. So you can approach those employers. Those employers, like if they're part-time, likely don't provide benefits. You can also approach larger employers who have people who are approaching retirement age, and you can offer to do lunch and learns. You can offer to speak to their seniors, because when people turn 65, even if they are receiving benefits from that employer, they still have to enroll in Medicare. And in many cases, Medicare becomes primary and their employer provides health insurance as the secondary payer. So just providing that information to groups is very good. There are networking organizations, chambers of commerce, joining those, partnering with other professionals, such as if you know anybody who's a CPA or a lawyer, elder planning lawyers are good. Real estate people, and schedule a time if you know people who are in these professions, just to have once you're up and running, just to give them your card, offer just, informational sessions, and you would really be surprised at how your business takes off. I don't buy leads. I do not believe in those. There are lead programs. So if you wanted to jump start it and you didn't really want to have to be out there in the world, trying to network and drum up business, you can purchase leads and they probably will pay off. It's just a harder road to go, I think, connecting to people. Once you do, practice this role of networking and really tapping into people you already know, you'd be surprised. You start to get, one or two people, and they say, "Oh, call Pam. She's, she can help you with your Medicare." And it may be something that someone's not 65 yet. I attended a CVS retail event. I had a little table and information out there in 2018. And last month in February, I received a call from someone who met me in 2018. She was still working and didn't need a Medicare plan because her employer, she had enrolled in the hospital part of Medicare, which is free to beneficiaries, and she didn't need my services, but she kept my card. 3 years later, I got a sale. She's new to Medicare because she's retiring. And so it is a cumulative, it's something that takes time to build up, but it is also a business that you can start earning money from, the very beginning. How much can I earn? So as I mentioned, there is a seasonal component to Medicare. So the bulk of your well, for my business, and speaking personally, because as I mentioned, there are ways to do this year round. The bulk of my business does happen during that annual enrollment period. Um, that annual enrollment period is a sign up period for a new plan, new Medicare plan, or change in plan that becomes effective January 1st of the next year. There is a delay. So if you sign somebody up during that annual enrollment period, you won't receive your commission until January. So, you just have, you have to realize that you put in a lot of work and then the benefit comes in January. The year-round opportunities exist for those who are qualifying for that special enrollment. And I mentioned either you're moving to a new state or you're retiring and first eligible for Medicare. But just a sense of the commissions, because that's what people want to know. How much time do I have to spend? How much money will I make? So someone who is new to Medicare and enrolls in a Medicare Advantage plan would get $672 per enrollee. So for a husband and wife, if they're both new to Medicare and both enrolling, which is frequently you'll find a husband and wife who are enrolling at the same time, your commission is $1,344. If they are changing plans, or it's a re-enrollment or enrolling in a new plan, they're already in, a Medicare eligible, it's half of that, $336 per enrollee. And then if they stay with the plan in subsequent years, you'll continue to make a commission on those people. It's just not paid up front. It's paid over the course of the year on a monthly basis. So when they re-enroll, if they stick with the plan, you'll make the first year commission, and then after that, you'll continue to make commissions as they stay in a plan. For the Medicare supplement plans, it's a percentage of the annual premium, and it varies from company to company. Generally speaking, a first year commission is lower than a Medicare Advantage, but you will earn commissions for up to 10 years on that. And what doesn't really matter. What matters is that you put people in the proper plan and that they're satisfied. Once they're satisfied, they're going to refer you to their friends. And that's the important thing to know. It is important to understand how much you'll make, but you really, really want to make sure people are happy. There are times, especially during the annual enrollment period, where people see so many commercials on TV and they're curious as to whether or not they should change plans. And there are times when I meet with people and I say, you're in a great plan. You do not need to change. It is not in my interest to switch people if they are in a good plan. And the chances are, when you do that, they'll refer you to someone who may need your help. So the point is always to do the right thing for the client, prospect, and the reward will come after that. So another question that people have is what organization are they going to be affiliated with? As I mentioned in the beginning, you're an independent agent. You submit, when you first contract with any of the private insurance companies, you submit W-9s to each one, and you're paid directly by those insurance companies for the commissions that you earn. At tax time, you'll get a 1099 for any compensation above $600 directly from the insurance companies. There are some exceptions to that. All of this, you're not really working directly for Aetna or United Healthcare or Cigna. There is an intermediate organization called a field marketing organization. The one I'm contracted through is called Ritter Insurance Management. I have a second one called Savoy, but they're a general manager. The field marketing organization handles all of the paperwork, all of the contracting, and in some cases, they handle commissions for certain carriers. But the majority, for my main companies, I get, monthly commissions direct to my bank account from Aetna, United Healthcare, Clover, Cigna. They come directly into my bank account. I'm responsible for reporting that, but I do receive 1099s in January for the business I did the year before. The other thing is that you will have a compliant broker website. I'll show you an example of that. This is an example of mine, and it's called medicareful.com. You'll have your own site. You can see at the bottom, it has my personalized information, my name. You can share this website with prospects. There's a lot of information. There's a whole presentation through here. What's Medicare? There are lifestyle discussions and content, blog type content about healthcare, about staying healthy, the vaccine, COVID, dental, staying healthy. There's a lot of content. This is a very professional looking website. If you want to, you can also have a Medicareful business card done with your information. I don't. I have my own, business card that's, that I have for my business. But if you like this look, and you kind of create a very professional branded approach to your Medicare business, you are, managing your own business. You're CEO of your own business when you are a broker. The other thing that I wanted to mention is that these companies have very, very easy to use enrollment tools. So the one on the left is Aetna. This is a screenshot from the iPad application. On the right is the United Healthcare's. This is a screenshot from the desktop application, but you could do it on an iPad or a desktop. iPad isn't necessary. I find it helpful when I'm meeting with people in the field, when I'm meeting with people face to face, to have the iPad. Laptop is fine as well, though. Timing and requirements. So I first started doing these workshops earlier in March, but there's some flexibility. The sooner the licensing happens, the sooner you start to make money. As I mentioned, my target is to have people up and running for the annual enrollment period, which starts October 15th. The training and the AHIP, or American Health Insurance Plans, Medicare certification, becomes available in June. I typically finish that around August. Every year I say I'm going to do it sooner. I think last year I actually did it in July, but the Medicare certification is really that kind of pivotal point. So that there is wiggle room in here, but I wanted to give people time enough to really feel comfortable with, Medicare, what is required, way in advance of October. So I'm going to share this. I have this as a PDF, this timing. The first part is the pre-licensing class. There's Exam FX, Kaplan Financial. There are classroom style courses through Exam FX, I think is normally $99, and through the Ritter Insurance Management, they have $30 off, so it's $69. Kaplan Financial is a little more expensive. It runs around $149. There's the health insurance licensing exam, and that's about $45. I think in New Jersey, it's separated out, right? So you can do life, health, or life and health. And I believe that each component is about $45 in New Jersey. Other states, you would have to check your state insurance department for pricing. Fingerprinting has to be done. There's a certain place you have to go for fingerprinting. The training will be provided the moment you pass your exam, we'll start training. Actually, I'm going to start some training classes before and while people are studying. I think it would help make the studying come together. So I'm planning to introduce some, weekly agent meetings, very short, kind of bite-sized sessions for people who are interested and are in the process of studying, just to get you excited, just to get you start thinking about your business and how you might be able to build it. And then the product training is offered by the different carriers. Depending on what county you live in, I would recommend which contracts you should focus on. There's no need to do all of them all at once. There are some carriers that are just not competitive in certain counties, and it doesn't make sense to overblow it. You can focus on the top 3 that you'd most likely sell in your county, but if you're interested in covering the entire state, we can discuss that. I will help each of you put together a plan, business development, marketing plan that would be suited to your circumstances and your interests, and whether you're doing this on a part-time basis or full-time, whether you're able to work during the daytime hours or if you're working weekends and evenings. For each of you, this might look different. And I'm basically here to assist in any way I can. So at this point, I am going to stop sharing and open it up for any questions. Any questions? So being that there are no questions, I want to thank you for your time, and you all can reach out to me. Again, you should have my information. Reach out to me and we can schedule a one-on-one to follow up and address, any of your concerns or next steps. I'll be happy to do that with you. Thank you.